health department team that's in the room, the broad range of community partners that are here from government, healthcare, all of our community services. I really appreciate people being here. And the attitude of this community about working together. We're in this boat, rowing it together, and I'm confident that we can continue to do that. Thank you to the media as well for being here. Today, we are going to give you a simple update on what has happened in the last 24 hours. As you all know, I am sure we have COVID-19 in the state. We do not have COVID-19 positive cases in Eau Claire County at this point. The state cases are here. We are planning and expecting that that might change in Eau Claire County, and we're prepared to deal with that. Governor Evers yesterday declared a public health emergency, and people hear those words and that may be scary to them. We want to be clear about what that means and clear about what that doesn't mean for Eau Claire County. This does give, through the governor's order, the state resources to respond. They're able to do some new things in order to respond that they may not have been able to do with that order. They also can bring dollars into local health departments and other places in our community to make a difference. We also have received some specific recommendations from the state that came with those orders. Again, 24 hours ago, when we didn't have the order in place, we have nothing new and different happening in Eau Claire County as far as cases go, but we do have some additional resources now that will be helpful. We really want to make sure that people don't hear the words public health emergency and panic. There is right now not a reason for panic. We hope there is never a reason for panic because we are well prepared. And we really want people to have good information and use that information as we move forward. The risk for getting sick from COVID-19 in our community remains low. If you hear nothing else, I want you to hear that the risk for COVID-19 in our community today is low. However, this is rapidly changing. So getting sick from COVID-19 is not something that we are concerned about currently in our community, but that is something that we are planning for and watching for very quickly. As soon as that changes, we will let people know. We've had many concerns expressed about how will we know if COVID-19 cases in our community. We will tell you. We want you right now to make sure that you're doing things to be prepared. So please do those things individually and as organizations to make sure that sick people stay home, that you are washing your hands, and that we are not spreading any disease that we have. That helps us now, and that helps us when COVID-19 cases are here. Again, there are no confirmed cases of COVID-19 happening in Eau Claire right now. We are testing for COVID-19, and we have people that have been in contact with COVID-19 cases that we are having self-isolate, and we are monitoring them. They are not sick. Self-quarantine is what we do when people are not sick. We're telling them to stay home so that we limit the potential spread of disease. A couple of new measures have been put in place by the state. We expect more changes will be happening, and our ask of you is to really follow the health department website. There's a coronavirus button on that website that is the place that we are regularly updating, and we are wanting you to go to that site to learn what's new today and each day following today. The measures from the state that have changed. The first is that the state is recommending that any large events, those over 250 people, postpone or cancel their events for the next 30 days. That will be reevaluated after 30 days, but the request is that any large event that is currently planned be canceled for the next 30 days. We are following that state recommendation in Eau Claire and actively communicating with all of our partners that are planning events of that size. That is happening as we speak right now. The second recommendation from the state was related to travel. So the state of Wisconsin is having recommendations that are currently in place to eliminate non-essential travel to states where there is currently community spread of COVID-19 and to countries where there is currently spread of COVID-19. The way to know about those states and countries is to go onto the CDC travel website. That information is very clearly available. The current states that we are recommending people not travel to in the US are Washington State, California, and New York. Those are the 3 current states where there's community transmission of disease. People that choose to travel to those states or go because of work, when they come back, they are being requested to self-quarantine for 14 days. Again, self-quarantine is a process where well people stay home so that we limit the number of people that they're potentially exposed to in case they get sick. They spend that 14 days watching their symptoms. If they become ill, we test them because they have been potentially exposed to the disease. Imagine if you were asked how many people, tell us all the people you came in contact with in the last 14 days, and you were going about your normal course of life. Very, very difficult to come up with a good, complete list of all of those that you've come in contact with. That is why, if there is someone that has had a risk of exposure, again, going to those 3 states or any of the countries where there's community transmission, those people are asked to stay home. Within that 14-day window, we know if they become sick or not. That's the amount of time that it takes for someone to be exposed and then get sick. After that 14-day period is up, we know that that travel did not create a problem, and then they are able to go back to work. These are well people that are home and being asked to stay home during that time. So again, the current states are New York, California, and Washington. As that changes, that will be on the CDC website, and we ask people to go there so they have the most up-to-date information. Again, that recommendation that came out yesterday, late in the day, is something that we are actively working on to make sure is communicated both to employers who may have employees traveling back and forth, as well as to places that work with those that travel and getting the message out broadly in the community. We hope that all of you are working within your families and within your organizations to really make plans for that change. It is something new as of yesterday. We also are really hoping, beyond the specific recommendations of the state, that employers make it easy for people to follow self-quarantine if that is something that they need to do, and generally to stay home when they're sick. Any disease spreads if people are going to work and coughing and sneezing, and we're asking for employers to really work on making sure that sick employees are not infecting others, and if we are telling employees to stay home with self-quarantine, that they're able to do that successfully. The state also clearly communicated yesterday, and additional guidance will be coming out later today, that schools are not at risk at the moment. K-12 schools and daycares, the recommendation from the state and the federal government, as well as from the local health department in Eau Claire, is a strong recommendation that schools stay in session. That is because we do not have community transmission, and it's a bigger risk to our community and to those kiddos if they are not in school. There are lots of reasons that we have kids in school. We know where they are, and their safety and health are much better protected by being in school. We are also working really closely with schools right now to make sure that that message is clear and to really help support them as they get pressure from the community to make decisions that are not science-based and not recommended. We really want to make sure that our community is supported in making good science-based decisions as we move forward. The health department has a team of people available, along with a whole variety of others that are helping us with that and responding to that kind of question. We want you to feel supported as you make decisions, both for your family, but importantly also in the work setting. So we are working with all of our various settings to make sure that they have the right information to make decisions. We don't want people to make decisions based on panic and based on misinformation. We currently have no COVID-19 cases in this community. We don't have a risk of spread, and we really want to keep that circle as protected as possible. That doesn't mean canceling events unless they're over 250 people. Health department is working hard, as are all of our community partners, in planning for the change to that. When and if that happens, we have lots of plans in place to move forward how we will operate in this community. Today in the room and in meetings all during the day today, we have been working with partners on that, and we really appreciate that strong connection. I mentioned schools. All of the schools, again, we're working in cooperation, sending clear communication to them, talking to key employers in our city and in our county, because we know that employers have people there every day and we want to make sure they're protected. We are talking again to those places where they have planned events in the next 30 days, and we will work closely with you if you have questions about that. And we are working every day with those key response partners. Our hope is that people use the health department website. Again, that's coronavirus.ecehealthdepartment.org as your place to get information. If you would like to talk to someone specifically, you can call the health department. We also have a specific phone line set up that is being monitored regularly, and that is 715-839-4725. We are working, as this potentially expands, to have additional resources like that available so people's questions can be answered. One of the most important things we can do right now is to not make it worse on our healthcare system. So we have right now influenza in our community, and we are having a difficult influenza year. Healthcare needs to be able to focus on that and focus on really meeting the needs of the people in our community that have influenza. We are asking that as people are sick with a low level of symptoms, that they stay home. If they are sick with an amount of symptoms that are similar to the COVID-19 virus symptoms and they've had contact, to immediately contact their physician and talk through what next. Please don't be contacting your physician for every runny nose in your household. I am a mother of 4 children, and I would call the doctor for every runny nose. There might be an issue. We know people are concerned. We care about that concern, but we want to help manage the stress on the system. Today, the healthcare systems in Eau Claire, again, a wonderful partnership, working together to have shared messages, have limited visitors to their buildings, and they have visitor restrictions that they are proposing. They will be sending out specific information about that. If you are going to a specific healthcare institution, please touch base, please look at their websites and be comfortable with what they're doing. Again, this is an abundance of caution. We don't have COVID-19 currently in our community, but it's part of our process to just pay attention to not spreading disease. We have an opportunity for questions now. My message to the community really is that we are working together. We have plans in place once the virus arrives in this community, and it's our job to keep that as small as possible, and we're confident that we will be working together to do that. So questions? Yeah.
You said when it arrives? Is it a when, not an if?
I think that given the pandemic nature, it would be highly expected that COVID-19 cases will be existing in this community at some point. It's difficult to say how long that might happen, but again, the question about when versus if is really related to the sense that this is a pandemic, and it is a communicable disease that is new and people don't have immunity, and it's likely at some point there will be a case in this country.
Yesterday, UWEC closed their in-person classes for the next 3 weeks. Why make the decision to do that on a college campus but not in our community schools?
So the question was, why is there a decision to close campus at a UW system versus a K-12 system? So there are a number of reasons that a decision like that is made. The UW Eau Claire administration did work closely with the health department as we were working to keep the campus open. The decision was made to close the campus in an abundance of caution, partly because they have people coming from lots of different places in and out of that campus, And the system as a whole, the UW system as a whole, was making decisions, making it very difficult, frankly, for UW Eau Claire to make a different decision. In Eau Claire, the Eau Claire schools have Eau Claire residents attending Eau Claire schools. We do not have COVID-19 in this community, and keeping kiddos in school until we may need to take other measures to limit exposure, which again would be down the road, is really the best decision. It's making the right decisions at the right time is really what our focus is. Kiddos that are here in Eau Claire, we really want to keep in school. Yes.
We're kind of seeing analysis from experts here in Wisconsin that if there is a dramatic spike in COVID-19 cases, that there may not be enough hospital beds to deal with that. Is that something the health department is thinking about? Is that something that you guys are looking at as a possibility?
Sure. So the question is really related to what is the capacity of healthcare to deal with potential spread of disease in Wisconsin. There is a system in place, most people don't know it, where healthcare works together on understanding what capacity needs are available and what response we need. We have a very strong team of healthcare partners working in this community. We happen to be a community that pulls, because we have big healthcare resources here, people come from many, many other places. We are confident that we, at this point, given what we know about the disease, have responsibility. One of the things we really need, though, is healthcare not getting tied up with those that don't need care. So again, the request to the community is to really think through when a visit to urgent care or a hospital is necessary. Very ill people need care, and those that are worried and not very ill, really encouraging not to use our healthcare system so we keep that capacity strong. We do have clear testing guidelines on our website. The testing for COVID-19 does have clear guidance. People that are at risk, we do want to have contact with. And at this point, the healthcare system, while is, may be stressed, we have an amazing resource in this community.
Are there any pending cases or tests of COVID-19 in the area?
So again, the question is related to pending cases or tests of COVID-19. We are working to have people self-quarantined that are contacts of potential cases. We are not, testing will happen as it's recommended and following the guidelines, and we work with our healthcare partners on that. If there's a concern about testing, the health department is notified because that is considered a potential case. Again, it's a reportable disease, so healthcare is working with us as they test and as we have diagnosis and diagnosis.
Can you say how many people are?
I don't, so the question
quarantined?
was how many are quarantined, and it's also a question about tests. I do not have a number, frankly, for either of those. The self-quarantine measure that the state just put in place means that if I went on spring break to Washington State, I now need to self-quarantine for 14 days. We're asking people to be in touch with us about that, but there are likely people that we don't know about. Those that are concerning cases, so those that have had an active contact with an individual with COVID-19 are being monitored closely, and we do have awareness of all of those people. Testing numbers, again, I don't have available right now.
Is it fair to say that we don't have any community spread of COVID-19 in Eau Claire County if we don't know how many people are being tested? We've seen evidence of community spread in Washington and other places. So how do we know for sure that it's not here? We just don't know about it.
Yeah, so the question is, how are we sure it's not here? So certainly we can't say without a doubt that it's not here, but anybody that has been in contact with a COVID-19 case, for example, we've had those people that are connected to cases in Wisconsin, is being carefully monitored. Anybody in that group that is self-isolated right now that becomes sick in that 14 window, we are immediately testing. We right now have nobody in that landscape that we are concerned about.
And just to follow up, the family that was self-quarantined here in Eau Claire, has that family been tested?
So the question was, has the family that's been self-quarantined been tested? So the testing guidelines are if an individual is symptomatic and a contact of a COVID-19 case or in an area where COVID-19 is spreading. The individual, the group that we are self-quarantining, anybody that is quarantined is by definition not sick. So none of those people are being actively tested until we see symptoms.
You mentioned that you recommend that workplaces make it easy if their employees do need to self-quarantine, but are you recommending that they take a stance of work from home if you can or anything like that?
So the question is, what exactly are we doing with workplaces related to self-quarantine measures or other measures? There are template plans available to workplaces to think through what will they do when this happens or if this happens. So those things like, can people work from home? How do people get paid in those situations or not get paid? What kinds of leave? Those are all things that we are strongly recommending people think through now so they don't have to make decisions very quickly if and when that may happen. Very similar to individuals, we are hearing some concerns in the community, and we're hearing this nationally about people hoarding supplies. The recommendation from the health department, from the state, and from the CDC is to have supplies available individually for 14 days. If I get called that I am a contact to a COVID-19 case, I want to be able to stay home or have someone that can bring me at least supplies during that 14 days because I need to stay home. So again, the 14-day supply is something that we are encouraging people to do, and then businesses, we're encouraging people to think about what if this might happen and have not institute those plans right now because we don't have cases, but when it's necessary, be able to quickly do that. Yeah.
One quick one. You mentioned the state guidelines on gatherings over 250 people.
Yeah.
Are there recommendations for smaller gatherings, either with regard to holding them or how to mitigate any potential spread?
Sure. So the question is related to what about things that are not quite 250 or not near 250. At this point in time, because we don't have COVID-19 in this community, we are not communicating really strong recommendations to do something other than hold your event. We are telling organizations that are having events to message strongly as you're having events about having people stay home if they're sick and wash their hands. We would encourage events to perhaps actively watch their group that's there, and if they see people that are actively ill, to ask them to leave. We are not right now giving recommendations related to other measures. We certainly are very willing to talk to any organization that has questions about that. And certainly we are concerned if it's influenza or if it's COVID-19 for gatherings where vulnerable populations may be. So those may be places where we have some additional conversations. But at this point, it's that 250 people. All right, thank you everybody for being here. We appreciate that people care about this topic, and we really want to make sure that you know what's happening in Clare. Thanks.